In the fight against COVID, we have all been asked to wear masks, but some people are going so far as to go into the knife.
10 on your side, Stephanie Harris looked into an increase of weight loss surgeries. Stephanie?
Anita, Tom, obesity is a big risk factor for bad outcomes with COVID-19, and surgeons report the number of people seeking bariatric weight loss surgery is surging.
Dana and Damian Burgess have been married 25 years. They've done it all together.
I put on weight during pregnancies and didn't lose it all after, and then had another pregnancy and put on weight.
Yeah, pretty much the same thing. So I had a few pregnancies. And
Like 40% of Americans, the Burgesses' ballooning weight led to real health issues.
I'm a prime example. I had diabetes for 11 years, and I was on 2 different kinds of insulin and an oral medication and medication for hypertension.
And that put them at a higher risk of dying from COVID.
Depending on who you talk to now, obesity is the risk factor for bad outcome for COVID-19.
As soon as the pandemic hit, a horde of potential patients began knocking on Dr. Anthony Terracina's door. The bariatric surgeon saw a 40% increase in consultations in just 1 month.
The interest seemed to have come to a head at the end of the summer, and there's really no end in sight right now.
Dana and Damian were already patients. Her operation happened 2 days before elective surgeries were canceled.
It feels freeing, really freeing. It's wonderful.
Damian was one of the first on the table in June when they restarted.
I feel more confident. I feel like I did when I was a young man.
While COVID concerns have kept some from having other elective surgeries,
We have yet had to have a patient who canceled, because I think our patients understand that this is their chance to get healthy.
together, Dana and Damian have lost 200 pounds.
Now we can put our arms all the way around each other when we hug.
They've cured their diabetes and cut their risk of death from COVID.
Yeah,
It's been great to be able to do this journey together, just like we've done everything else in life together.
There are several types of bariatric surgeries, with gastric bypass being probably the most well known. It takes about 6 months from consultation to operation because there is a lot of hard work and education involved. And not all insurances cover this, but if you're interested, doctors are now doing virtual and in-person appointments. Stephanie Harris, 10 on your side.